In a short while, I'll show you the treatment that I utilize to improve symmetry and restore mobility, and I'll show you the improved motion in the pelvis. But I thought I would have the client describe how she feels now. She got up and walked up and down the hall and came and sat in a chair. So can you give us some feedback? And if you could speak a little bit loud.
Yeah, before I would walk and I would just feel like my left side would just be stuck when I landed on my left foot. Now I actually feel like I actually have spring when I walk on my left foot. I feel straighter. I feel like I can walk with my body symmetrical on both sides. When I sit, I feel like I'm sitting evenly on both sit bones and straight up and not sitting with a twisted with my shoulder forward.
Nice.
So I feel more even, and I even feel an instant relief in my neck pressure on my left side.
Yeah, so your upper body has to compensate for anything happening in the lower body, and so that's a very positive sign that you feel better up high. Good. Well, I'll demonstrate the treatment that I did. So first I stretched the left hip. So I bent the right leg over, and then I stretched your left hip going into adduction. Okay? We did that for 2 minutes gently. And then I stretched your right hip into abduction, and I also added traction while I did that stretch. Okay? And now lie on your stomach, please. Then I bent your knee to 90 degrees, and I rotated the right hip into internal rotation, and then I stretched the left hip into external rotation. And I failed to show you that her coccyx was side bent. I don't think I demonstrated that, did I? But anyway, the sulcus on each side of her coccyx is now equal. I also mobilized the coccyx, pushing on the ligaments on the right side of the coccyx. I pushed them to the right for 2 minutes, and then I came and I hooked underneath the tailbone, under the coccyx, and I stretched that to the left for 2 minutes. And so now, when I palpate, she has much improved symmetry of the sit bones, and I can now take up the slack. So I can push it to a stop point, and then when I add an additional thrust, then there's spring and recoil mobility. And that's true in this side as well. I can take up the slack, and then I can spring it. It springs and it recoils, and when I go from the right to the left, I can take up the slack and spring it. When I come medial to the left ischium, I can take up the slack, and then I can spring it. And I see that movement going through her whole body. And so she did have some blocked movement in the SI based on this pelvic malpositioning. And I think this pattern involves the whole pelvis as it moves with the trunk. I think it involves the hip joints as well. And it certainly has an influence on sacroiliac mobility. And so there might be a positional, maybe the sacroiliac side bent to end range. You know, no one can look inside that joint in the clinic, so we have to be really cautious about any claims that we make. My only claim being that her pelvis was asymmetrical, as was her coccyx. She was very aware of it in walking, standing, sitting, and bending, and that she feels much more symmetrical and freer when she walks, feels a release of tension in the neck, and she feels like she now sits symmetrically. And so I'll demonstrate the improvement in position. And so the right sit bone is here, and left sit bone is here, and you can see that's much more symmetrical in relationship to the midline crease. You also felt like when you bent forward, you bent asymmetrically. Do you want to stand up and bend forward and see what that feels like?
Sure. Yeah, I'm straight now. Whereas before I would bend over and my body would go this way.
Aha, so it would shift off to the left. Go ahead and bend forward one more time. Beautiful.
And my hamstring would pull all the time when I would
Yes.
Now I don't feel that anymore. I would feel pain all the way up my groin. Now
Very good.
I don't feel that. I can actually touch my toes without pain.
Excellent.
Before it would just always go that way.
Wonderful. So this is a pattern that I discovered long ago, and I named it left lower windswept pelvis. And it's a movement dysfunction involving pelvis, hip, sacroiliac, lumbar as well. And it's pretty simple to correct with the treatment that I did to you, and I'll teach you the same stretches to do a couple times a week, and that should keep that symmetrical.
Good.
And I'm glad your upper body responded well to it as well.
Me too.
So thank you for letting me demonstrate.
Yes, thank you very much. I appreciate it.